Scarcity in Canadian Disability Support Access by Caitlin Polakowski. Hello, my name is Caitlin Polakowski. This is a presentation on the scarcity in Canadian Disability Support Access. What is scarcity as it relates to microeconomics? It is a situation in which the ingredients for producing the things that people desire are insufficient to satisfy all wants. Scarcity as it relates to disability support needs in Canada. Access to services and supports in Canada for the nearly 8 million individuals with disabilities are often unmet. These result in poor scores in quality of life measures. Persons with disabilities often require more services and supports than persons without disabilities, but many also report higher rates of unmet needs for various types of support. Having a young child with a disability in a very remote location of Canada has brought to light the truly limited access to supports in Canada for individuals with disabilities. Limitations on not only availability, such as being able to access speech therapists and assistive devices such as AAC communication devices, but also the expenses of accessing these affect one's ability to receive the supports they need. From my personal experience with the shortage of SLPs, it has resulted in high expenses for private speech therapy and years-long waits to be able to access assessments for AAC communication devices, which can only be matched through government-assisted coverage by a specialty clinic in Sudbury. The data. The rate of unmet needs among persons with disabilities varied by type of support. 13.5% have difficulty accessing prescription medication. 22.7% have difficulty accessing assistive aids or devices. 32.7% have reported that they have difficulty accessing help with everyday activities, and 45.7% have had difficulties accessing healthcare services. These numbers seem high, do they not? But can you truly imagine not having access to everything you need for your day-to-day life when it comes to your health needs? This is what individuals with disabilities face every day, affecting their independence and health. So what? In 2022, 13.5% of persons with disabilities reported that they were unable to purchase medication or took medication less often due to cost. Among those who use prescription medications, 44.2% reported not being reimbursed for some of their expenses, with over 4 in 10 of these individuals indicating their out-of-pocket expenses were over $500 in the last 12 months. The effects of having unmet needs when it comes to individuals with disabilities results in improper medication use, inability to live independently, and a reduction in quality of life. There is also the limited access that hospitals and healthcare providers face due to these patients not being able to access the supports they need, resulting in their time spent trying to find alternatives or having to treat health-related problems that arise in their patients because they are not able to access their needs for the health and everyday living supports. In conclusion, the scarcity of medical treatment and access to assistive devices greatly inhibits those with disabilities in Canada from being able to access their needs. These result in poor quality of life, limitations, and additional financial burdens. Among persons with disabilities, a variety of barriers leading to unmet needs for aids or devices have been highlighted, including affordability, lack of support or information, or lack of availability. There's a huge lack of support for and accessing information for those with disabilities. I know personally that it has taken years to learn of all of the different types of access and supportive measures out there that can help cover the financial burdens.